Hello and welcome to White Coat Stories, where we talk about the emotions, experiences, and stories of different healthcare professionals from all around the world. I am your host, Reshma Prasai, and I would like to welcome you all to the first episode of White Coat Stories. Today, we are going to talk about the topic that's been long the heart of healthcare: burnout among healthcare workers. And we are honored to have with us our incredible guest, bringing us unique perspective and years of experience in the field. Joining us is a mental health practitioner who have been working tirelessly to support healthcare professionals alongside RZ, a dedicated nurse, and many more. To kick things off, I would like to welcome Sushmita Bogati. Welcome to White Coat Stories.
Thank you so much, Reshma. Thank you so much, everyone, for being here. And it's an honor to be in the first episode of this wonderful session, I would say, or wonderful program. So thank you so much for this.
Thank you so much. And without any ado, let's dive straight into the topic. So, I've always heard about burnout syndrome, but I've also heard about stress or compassion fatigue alongside, and it always confused me. So, and that is why I would like to ask you, what is burnout and how does it differ from all these terms like chronic stress or compassion fatigue? Is there any type or such?
Yes. When we have to talk about the symptoms, sign and symptoms, or the things or the causal factors sometimes look same in burnout and compassion fatigue or the stress, but the causes or the inner cause can be different. Like in burnout especially, it occurs in a professional setting where any kind of job, any kind of profession can have a burnout in a corporate sector or in a medical sector or in any kind of businesses or anything. It's like a imbalance between the work culture or the dedication that you're having and the demand that organization wants and the supply that you are being able to give. And it's kind of a long term. It's not about you work for 1 or 2 days or 1 month, 2 months, and you have a burnout syndrome. But it's about a long-term working in a field where you no more feel like you have energy to do it, don't have that dedication to do it, don't enjoy the things that you do. And it's mostly like it's a lack of joy in the success and you have amount of dreads of failures that you are feeling right now. And it's about the exhaustion that you feel when you go for the work. It's more about professional thing than a personal thing, but it affects your personal life also, burnout. And similarly, compassion fatigue is also related to the work. Especially when we talk about compassion, it's about a feeling, empathetic feeling for others. So compassion fatigue is mainly related in the field where people work with other people, or mostly the caregivers or the person who work for others. They mostly have the compassion fatigue. So burnout is about the professional setting. Any kind of profession can have it, but compassion fatigue is about the usually happens in the profession where there's about giving care to others or working with others. Like in the example of it mainly happens in the medical setting, in the clinical setting, I would say, in our mental health setting, in army, in police officers, or in advocacy level also. Wherever we work with other person, it happens there. So the basic difference about burnout and compassion fatigue is this, Resmaji.
Okay, thank you.
So would you like me to have more?
Yeah, I would like to ask about, is there any time frame where to diagnose a burnout syndrome, such as like we just discussed that it's not just 1 day or a month. So is there any time frame where a client is being diagnosed for burnout syndrome?
I have not found out any kind of such as a time frame that we have burnout, but usually because I also have faced that, and it was like a 3 years, 4 years journey for me that I felt burnout in the third or fourth year of my work. So it may be in a year or in a year and a half, maybe. But if the work is too much of overload, then it might happen in a 6 month also. But it's not a short-term thing about 1 or 2 months, but maybe few months or a year or more than a year. So according to my study or research, it happens in a long term, I would say that.
Okay, so is there any stories or happenings that you've seen or faced, or the stories of certain people who have come to you and shared about their burnout journey?
Uh-huh. Yes, yes, because I myself have faced the burnout, that symptoms of having burnout in my work, because it's very natural and it happens with so many people. We don't talk usually about it, and it's in a setting like in a Nepal, in a country like Nepal, talking about is very less because there are no policies, there are no many strategies where we talk about burnout, and we do not know about burnout. We do not know about mental health, so burnout is a very far faced place to talk about. But having a burnout, the people or the clients that have come to me for the counseling, they usually share that it's about being not that active when you want to work. You don't want to go to the work. You used to love that work, but nowadays you do not love that work, so that kind of interest has been less. There's a feeling of energy depletion or exhaustion. You like feel exhausted. Maybe you have not done so much of work. You are not in your laptop so much, or you might have not done so much of work to see as a result. But there's a constant exhaustion in yourself, in your body, in your mind, in your feeling that you don't feel happy, and there's an increased mental distance from one's job, or feelings of negativism, like I don't like my job, I'm not doing myself, like the negativity towards the job. There's one thing that there's a negative towards the job and towards yourself also, that I'm not being able to do my work. What is happening with me? I'm not being able to meet the deadlines, or I'm not being able to do the work that I'm supposed to do. So that constant feeling of guilt, a constant feeling of exhaustion is there when there's a burnout. And of course, there is a reduced efficacy, like you are not being able to do your work properly, or their deadlines are gone, you don't have any creativity level, you are not enjoying your work. So these are some of the symptoms that we feel, and it is also felt in our body. So whenever we talk about any topic of mental health, we do not have to, we cannot forget about our body, because the symptoms that we see in our body is the main parameter to know, or it's a big sign that okay, I need some help, or my body needs some help. So you have constant fatigue, you have headache, you might have some migraine attacks, you might have some constant pain in your body, you might have tremors, you might have constipation, or maybe diarrhea, or your eyes are burning, your heart is palpitating. So anything that's happening, and with the emotional drain, so you are feeling drained, and maybe, so knowing all the signs and symptoms in your body, in your mind, and in your thoughts, and the energy level that you're having in your work, and the difference in energy level, I would say, the way you used to love your work, or the way you used to do your work, and then now the change in that, or the depletion in the energy while you are doing your work, might be some of the symptoms, or might be some of the things that most of the people share about, and even I also have felt. So these are most identifying signs of a burnout.
Yes. So this means that our body is always alarming us whenever we go on the wrong
Yes,
side.
yes, yes, very much.
Yeah. So this is the thing that we healthcare professionals especially are facing almost everyday basis. And sometimes, like you really are understanding what's going on with your body. You understand that you need a break for some time. But for some people, there is this unavoidable circumstances. Maybe for some, it may be the economical. For some, they might be under certain pressure to complete certain work. And there is this huge pressure that you can't leave it, or despite knowing that you are undergoing through the certain kind of pressure or the burnout. So in that kind of cases, is there any activities or a technique that can help people at least reduce burnout to some extent, or manage the symptoms that they're experiencing?
Yes, because this is a very big problem. Whenever I take some sessions or in a workshop, or about work-life balance, about burnout, about mental health, there comes a question. There obviously comes a question that I cannot leave my job. I cannot have a long break. And whenever I'm in a break, and whenever I come back to my office, it's the same. I'm in the same situation, so it's not going to change anything. Or what are the techniques that I can use when I cannot take a break, or a long break, or even in our medical medical professional in Nepal, the nurse patient ratio or the nurse doctor ratio, or any medical professional, the ratios are way too low than the protocol. So having leaves, having a break is like out of a question for us. So at that time, what we can do is we have to put on some more effort. Yes, we don't have energy, we are exhausted, but we have to do it for ourselves. Take some time for ourselves, maybe some mini breaks or micro breaks, even of a 2 or 3 minutes or 5 minutes of break every hour, stretching your body, getting out of that zone where you are just exhausted, when you are not feeling like you are in that place. So some having some tea break or a washroom break, just washing up your face, taking micro breaks of 5 minutes, and just healing your body, refreshing your body, getting out of that place for some time. And whatever you do, the work that you are doing, being mindful in that. Because sometimes we're exhausted, we have burnout because we are having that constant feeling that I'm not doing good, I'm not happy, what is happening with me? That constant thoughts and emotions are coming in our mind, and trying to avoid that or trying to overcoming that by practicing mindfulness. Whatever you are doing, if you are caring a patient, you are giving a medicine, or if you are studying, or whatever you are doing, just being mindful of that. Yes, I am having this situation, but for now it's my time to work or to study or to do anything. So being mindful in whatever you are doing, so you don't need break to have a mindfulness session with yourself. And there's a technique called grounding technique, which is a 5 4 3 2 1 grounding technique. So whenever you feel overwhelmed or feel like you are not in a place, you are not happy, or you feel tired, at that time just take a long deep breath. Maybe in that also there's a technique of diaphragmatic breathing,
Yeah.
where you take a deep breath for 4 counts, and you stop for 2 holes or 2 counts, and you exhale from your mouth for 7 counts. So 4 2 7, 4 2 7. Just have a deep breath whenever you can for 2 or 3 minutes, and after that, just look around the things that the 5 things that you, whenever you open your eyes, look at around the 5 things that you see at the first 5 things. 4 things is, you try to listen to any 4 things that you can hear around you, and try to touch any 3 things by not moving much. Just when you are breathing in and out, try to touch 3 things. Then try to taste 2 things that's happening in your mouth, any like a taste of a water, tea, or your food, whatever you're having in your tongue or in your mouth. Try to take that, or try to identify the taste, and try to smell 1 thing. So it's a very short technique, but it's a very effective technique. It's a 5 4 3 2 1 technique. So whenever you are feeling anxious or whatever you are feeling, you can just try this technique, and it will refresh you for sure. And another thing is, when we are not being able to take a break, as Reshma you asked me, which is a very big problem, as I said, is that we have to loosen up. Like, we cannot give pressure to ourselves. We cannot have unrealistic goals or ambitions that we have, because at first the priority at this moment is you. Whatever you do is a self-care. Whatever, breathing or having a walk or taking a break, drinking water, drinking tea, is for you. So love yourself, take care of yourself in small things, and have some realistic and small achievable goals. Today I'm not feeling well, I'll not be able to do this thing. That's fine. Whatever I'm able to do it, I'll just sort it down. I'll just do some achievable and realistic dreams. So have that, set small goals in a daily or in an hourly practice, and having that, and giving some time for yourself to heal. Because time and again, when you are just scraping your wound, it won't heal. So whenever the wound of like any problem that you have, any trauma that you have, any exhaustion you have, it's like kind of a wound that you have in your physical body. So for the physical healing also, you need to have some rest. Similarly, taking breaks, small breaks, and whatever you do for yourself, loving yourself and giving some time to yourself will heal. So having these kinds of things can be done in a busy schedule. And not to forget is setting up the boundaries in work, in professional life, and in personal life. So trying to say no, practicing to say no when you are not feeling good, or when you don't want to do, or when you feel like you cannot do it. Just don't be a saint and just say it. I'm sorry, I'm not being able to do this. And saying no, setting up the boundaries, having a boundary of care and respect for yourself also. So practicing these things in your daily life, in your work, in your daily schedule can help you a bit when you don't have long days to rest. So I think these are some of the techniques or tips that we can use when we are busy, Resmaji.
Yeah, never thought about this. Yeah, we just really dip inside on taking really mini and micro breaks whenever possible, some stretching and deep breathing and the grounding techniques, and setting realistic goals rather than just focusing on big amount of work that are left to do. Incredible. So I was coming into this topic on setting boundaries and all. Being a healthcare professional, we are really busy and we belong to a very critical and sensitive situation. Oftentimes, we are involved in those kind of situations where setting boundaries, sometimes is very difficult. So, for especially healthcare professional nurses, without having this feeling of guilt, like they're not enough for the patient, because when you are not feeling good, it's often like the quality of care that you deliver might be compromised, and you know that you are not being able to give your best. So, in that kind of situation, how can one, set boundaries without feeling guilty?
It's kind of difficult at first, I would say, because in our culture, in our upbringing, we are never taught about setting boundaries. We are never taught about saying no. And it feels like whenever we say no or we try to set up boundaries, people treat us, not only people, but we ourselves treat us that we are doing we are being selfish, we are just loving ourselves, and we are just ignoring other person's needs and necessities, and we are saying no to ourselves. But we have to change that perception. Yes, every time we cannot say no when we are in professional or in a personal settings also, but setting up a boundary is basically about being in your comfort zone whenever you are not ready to get out of your comfort zone. It's not always about getting out of the comfort zone, because sometimes we don't feel like we want to get out. Sometimes we feel I want to have a low pace. I want to work according to my energy and my level of dedication that I want to give right now. So first of all, knowing yourself, that what are the things that I'm able to do it at this time or at this time frame, am I able to do it or not? So if you feel like, yes, I'm able to do it, I can do it, then well to do, we can just go with that. But setting up the boundaries might be difficult. Saying no, that for this time frame I'm not able to do it, or I'm not feeling well to do it, or I don't want to do it, I want to take a break, might sound selfish. But once or twice, thrice, you do it again and again. You say it, you try to clarify yourself, but not much in a bigger level or in a deeper level. You don't have to clarify to any other person. If you feel like you are not being able to do it, then just say it. Because at few times people will think that you are being selfish, or you are just controlling others' environment, but slowly and steadily people will understand. And first of all, you need to understand yourself, that are you able to do that or not? About setting up the boundaries, are you able to do that? And yes, having a change in any environment is not an easy task. You need an effort to do it. So setting up a boundaries is not an easy task, and in our society like Nepal, it's very, very difficult. And in medical professional, again, about all the pressure, all the patient ratios we have, it's very difficult to set up the boundaries, but we have to do it. If we have to fight for it, we can do it. If we have to just be harsh sometimes, then try not to be, but we can be harsh sometimes, because it's for you. If once you just do not set up your boundaries and let the other person be in your personal space, then they will come inside, because they do not know that what is a level of tolerance that you want to have. So having that, you should know that what are the things at this level I want to do or I don't want to do, and saying it politely also matters, because we all are in the same society, and all of us are not known about setting up the boundaries. And like, I'm also being confused that how can I particularly make clarify about setting up the boundaries. So I used to talk with my foreign friends or my teammates who are from other countries. I used to say that, how do you set up the boundaries? And for them it was so easy. Like, is it a difficult thing to say no? Is it a difficult thing to set up your boundaries? It's just difficult to have a personal space. And I was like, yes, it is difficult for us because we don't know how to do it. And for now, Resmaji, to be honest, I don't have a exact answer about how to do it. I'm also practicing on it. Sometimes it feels overwhelmed and people don't understand. Even I don't understand what I should say. I should not say. But for now, I would say is, if you're feeling exhausted, if you're feeling tired, or if you feel like you don't want to do it at that moment, and it's not a right time for you, just say it. I cannot do it right now. Or is there any way? Or is there any person who can help me if you're in a professional setting? That because I'm not feeling right, that I can do it myself. So I think that's some of the techniques that we can use in a medical line, but I'm also in the verge of studying about it,
Yeah.
about the boundaries in the medical professional line.
Yeah, it's quite a difficult thing, and I totally.
Yes, so I'm also confused. Maybe our listeners might also be confused about what is he saying exactly. But yes, it's what it is.
Yeah, because especially in our field, we have never been taught to say no or to
Yes.
not give something that you have. It's always about giving, because we have been taught since the initial days of our university that we are giving. Nursing is all about giving. So we just are really
Yeah.
confused at this point about when to say no and when to say yeah, I'm right there and I'll do it. So and
Yes, Reshma, you reminded me a nice thing that I interrupted you in the middle. But I just recall that whenever we had a study of 3-4 years in our study, like 4 years and 3 years of study, there was not a course about stress management.
Yeah.
There was not even a chapter of self-care. So everything was about giving, but not fulfilling ourselves. So that's a big problem from the starting, and we are just hooked up in our mind that you have to give whatever it is. And Florence Nightingale used to walk in a lamp in the night and see work for 24/7. So we are expected to do the same, but it's not about self-care or anything. So I think we need to work from the ground level about caring about yourself so that you can give it to others once you are filled.
Yes, and also about the youth silence that hovers around, especially in this topic. We never talk about it, even though someone is experiencing burnout, particularly in a unit. There is, I don't think. Anyone would talk about it with other colleague, or there is very less amount of people who would choose to talk on it. So the another question would be like, how can one person initiate the communication in a healthcare setting in a unit, the unit which is extremely busy, without hampering their professional image at work? Because the in charge or everyone is just constantly judging the way you work, and even a minute amount of declination in the quality of your work can really trigger a lot of talk and the image that you've created since long time. So is there any effective way of initiating a conversation, especially in this burnout kind of topic?
Yes, actually, we are working. I was working in this project in an organization called Unity in Health Nepal. So we are working in few of the hospitals, in the primary hospital, tertiary hospitals of Nepal, especially Kathmandu Valley, where we work with the nursing in charges separately and with the younger nurses. And there's mainly the topic of our project was, or the subject of our project is leadership, how the in charges can work with their colleagues who are junior, who are just less experienced than them. And whenever we talked about, there's a huge gap between the staffs only. Like in any unit, also an in charge is not well equipped to understand the feelings that a junior might be feeling, and a junior is not well equipped about the knowledge and the pressure, or knowledge about the pressure that an in charge might be having. So there's a gap between the experienced ones and the new ones, and both of them had a different school of thoughts in their work. So When we had some research and assessment, we found that the bigger issues is with the policies of the hospital and also of the government also, because whenever we new staff is enrolled in a hospital, in any unit, there's no any particular order of giving an orientation. They just saw the hospitals, they just say about the equipment. It is the equipments are here, there are number of beds, and this is the board, this is your nursing station, these are the work that you have to do, and it's done. But having the orientation or need also be the orientation also needs to be included with the relationship maintenance or a rapid building with the other staffs, also talking about their experiences, because a new person also has their own journey, and to know about that and to know about the journey of experienced one is also very needed, because there's no any relation. There's a constant fear between the junior and the senior nurses, the in charge and the matrons, that whenever they come you are very scared to talk with them, and if you're having a burnout there is no place to talk about it. Where can you go, because you are not being able to share or you express yourself, and that's a very difficult place to be. And maybe as far as possible you would be sharing it with your same level of colleague who is facing the same, and you'll just talk about it, but there's no any solution to it. So you'll just talk about it, you'll have the burnout, you'll be hating that person, you'll just talk about those person, you'll backbite or you'll just leave the job and anything, but there's no place to express yourself. So first of all, good orientation about the place, a rapid building between the staffs, between the units, about ourselves or how we work, what are the policies that we work, and if you have a difficulty, then where can you go, how can you speak about it, that's there. And also teaching the charges about a good leadership skills, how to deal with their junior subordinates, with their workers, with another in charge, with the metro, with the administration staff, was how to deal with it. So having that skill with them is also very necessary, a space to talk and a space to listen also, not just about writing a report or giving a mail and sending it to the higher authority, but a reply, a response from that, and working on that also. So a two-way communication is very important to talk about it, and that constant fear of senior and junior, the bully, the stigma of or the fear between the colleagues should be decreased, and a friendly relationship should be there, and knowing about or understanding about each other is very, very important. So it's about starting from the day one. When you are starting from the day one to have a good rapport, then only you can have a good relationship between the colleagues. And if you have burnout, then you can just share it with them. I'm not saying that if you have a good rapport or good relationship, you will not have burnout. You might have burnout, you will have burnout. Any person at any level, how much they have worked or how fresh they are, any person can have a burnout, but there should be a place to speak about it. There should be a place where the person can listen to it and understand it. So maybe there are person A and B. B is feeling very burnout in their work, and B only knows about burnout. C is expressing herself, but A does not know about burnout. So she will be clueless and what is this talking about. So what am I supposed to do, because I have never heard about burnout. Whatever she's saying, I felt it few years back and I've overcome it, because the problem I see in most of the senior nurses in our hospitals, in our clinical settings, or in our college and administration settings, that they say that we have faced it and you should also face it. It's a very normal pattern of being in a nursing paternity or in a medical, in doctors also we see that we have also faced the bully, we also have faced the pressure or the nurse patient or the doctor patient ratio. We have already faced all this and you have to overcome as we have done. So there's nothing big deal that we have to talk about it. So everyone should be knowledgeable enough information. There should be the proper information about burnout, about stress, about compassion fatigue, and what to do about it, where to go. Is there any referral mechanism? Is there any counselor over there? Is there any psychiatrist, or is there any person trained in this? Then there should be a space. Then only I think this role of helping each other might work. I think, Reshmaji, we should start it from the day one, and from the level only we should be starting it, I guess. I feel so from our study and research.
So upon knowing all these things, I feel like there should be a different unit in a hospital who is responsible for teaching all the nurses or healthcare professionals about all this topic, and also a specific or safe space, women's
Yes.
privacy, where you can go and talk about how you're feeling, and the kind of, like helping system around. Maybe I think a
Yes.
unit in a hospital would really, really help decreasing the burnout or managing burnout to in a massive level, I would say.
Yes, yes. Also, unit, and to shortly say that being very flexible or very open about when you talk about mental health, and as we are so much prone or so much happy to have a sick leave or physical sick leave, we should also be very open to take a mental health sick leave also. So
Yeah.
whenever a person asks about having, I need a break, I need to sleep at home, I'm not having enough sleep, then that should be also counted as a sick leave. So starting from there, taking mental health also as a health, and having a mental health breakdown also as a physical sick leave, then from that on it will be more easier for us to talk about it.
Yes, not normalizing all these things.
Yes.
The problem, I think,
Yes.
lies in normalizing the burnout, normalizing the mental health stigmas. So I think we can work around these areas to definitely improvise healthcare system along with the quality and the mental health of the healthcare workers. So while
Yes.
talking about this, is there any kind of mental health support that are especially being provided to the healthcare workers, or any resources that they can go and access whenever they are feeling low or burned out?
Yes, because I have been working in, I was working in an organization who worked with nurses especially. So me being a nurse also, and we had a team of nurses from an organization which was UK based, and in Nepal it was named as Unity in Health Nepal. We work specifically for nurses, but whenever we used to work, there are not other organizations who are working for nurses. Even the nursing council is about administration, but our nursing association also doesn't have done so much of work I've seen, and there are not much of organization who specifically works for for the medical professionals. So where there are very less places specifically for them. So we have to look for other general places about the helplines or the counseling centers, government facilities where we can go and have a mental health support. But specifically, there's a very less organization that are working for the medical professionals. We need more of them. But if anybody wants to have professional help, we can go with any other organization who works in counseling or in mental health areas. So we can explore according to our time frame or areas that we want to work on.
Okay, so while talking about the huge topic of burnout, and while slicing it up, I think we've come up to this point where we are talking about the policy level, which is definitely not in our hands, and that needs a massive improvement. But we're also talking burnout on the personal level, where we have to focus on ourselves, doing this kind of self-care, taking mini breaks, and just focusing on ourselves, being really mindful, and some kind of stretching. So these are the things that one can do, although they seem very minute, but can have a tremendously huge effect to deal with burnout, and taking some small spaces or gaps or holidays or breaks whenever we can. So these are the kind of things that we talked about today, and we are almost at the end. And as we're wrapping up, is there any message that you'd like to share with our audience who are listening to this podcast, or some call of action to some organization or anything?
So at last, I would say is, first of all, identifying that you are having some issues is the first step of anything. Yes, as you said, that we cannot work in policy. Everybody cannot work in policy level, and we cannot depend on them also when it's about my self-care. I cannot wait that whenever the policy will change, where the system will change, and I'll have some good health. It's not going to happen like that. First of all, you should be identifying yourself, that what is happening with my mind, my body, and my feelings. What is happening with my eating habits, with my sleeping habits, and what are the changes that you want to know. And after that, whenever you feel like, talk about it, talk with your friends, with your families, with your trusted person, and try to have some self-care about the things that we talked about, the small breaks, about stretching, about meditation, yoga, walking, whatever you feel like you're having would make you feel good. And another is, do not hesitate to take some professional help, because it's like a different thing. Like, you hear your own thoughts from a counselor or a psychologist, you hear your own thoughts, but in a different way. So it's kind of a different approach to know your own thoughts and what am I thinking exactly. So hearing it from another person is gives you a different perception about yourself also. So do not hesitate to go for counseling sessions whenever you feel like you are not feeling good, because that also helps. And talking with the trusted persons, and yes, as I said, first of all, identifying yourself, because well, if we, until and unless we do not identify ourselves and we are not agreeing on ourselves that yes, I'm not feeling good, the more other person will say, it doesn't matter that how much the other person insists you that you need help, until and unless you or you yourself feel that okay, yes, I need a break, I need to feel good, there's something happening with me, I need some help, or I need some break. And identifying yourself and talking about it, and then taking some professional help, is the three main ways of taking care of yourself. So whenever it's about burnout or any kind of mental health issues.
Yes. So I think we tried to cover a lot of things when we talked about burnout. And it was, we are almost at the end, and it was very insightful topic. But of course, it needs more attention from all the level, including our personal level, from healthcare professionals themselves, and the different levels that are involved in it. So we are almost ending this session. So at last, I would really, really want to thank you for giving such insights on this topic, which definitely is very, very important, especially as we move forward to our life, which seems really busy. Ignoring our mental health would be a huge mistake. And of course, focusing our self towards improving ourselves, including taking care of ourselves, would be a really great step towards preventing and managing or recognizing the symptoms of burnout. So thank you for your session, and I would also like to thank all of our audience for making their time to listen to this podcast. If there's any more thing that you want to add, then definitely you can reach us via email or messages. We are always there. Thank you for listening.
Oh, yes, thank you so much, Reshma, for this session and welcoming me in the first session. So not taking a much of a time, I would like to thank everybody who is listening, and please take care of yourself. And having a mental health breakdown or having any issues is not about being you weak or wrong. It's just about a time frame, and everything will pass. Yes, again, thank you, Reshma, for initiating this topic about the about medical professionals, and it's so good to talk about it, and the way you are so much concerned about your fraternity looks amazing, and I hope your program goes worldwide and many people can get benefit from it. And thank you again for inviting me here.
Yeah, likewise. The feeling is mutual. Thank you.
Thank you so much.